Ahead and get started. So welcome everyone. It's Wednesday, February 15th, and we are excited to have you all with us today. So just a heads up, we are recording our session today. And thank you for joining us. To save bandwidth for all of our attendees, I'm going to ask that everyone turn off their cameras and mute themselves during the presentation. And I will be monitoring the chat, so you can share your questions there. You can also share those questions with our presenters today too. We also have a guest here, Nancy Heron. She is going to be running tech for us today, so thank you so much, Nancy. While we are recording today's session, Alice will share in a follow-up email any additional info and answer any additional questions if you have. If you are uncomfortable with your name showing, you can change your name to anonymous and then private message Nancy with your name for our attendance, okay? Also, if your Zoom name doesn't match the name you register with, go ahead and change your name now, or you can let Nancy know as well. So I do want to do a land acknowledgement. TCINN is headquartered in Austin, Texas, and as such, I am on the ancestral and unceded land on the Tonkawa, Comanche, and Sana people. Our ongoing colonial presence on indigenous lands compels us to take action now to counteract the effects of colonization. The work we do through TCIN Network is one small step towards that effort. Learn more about land acknowledgements and how to find out about where you are. And I'm going to go ahead and put the links in the chat. And then also to learn more about land acknowledgements and how to find out more about where you are, I'll go ahead and put a link for that in the chat as well. And also to learn more about the Tonkawa, I'll put a link in the chat so you can, look up on that and check that out as well. So without further ado, I know because I can be a chatterbox. I would like to welcome our speaker, Mark Ferris. He is with Texas A&M AgriLife and working with the Community Conversations on Health grant with DSHS. And so what I will do is I will mute myself and I will give it away.
Great. Thank you so much, Robin and Nancy, for your help. Alice as well. I'm here with Dr. Mike Lopez. He will be joining in just a bit. My colleague here with Texas A&M AgriLife Extension. My job, at least the first, is to share an overview of One Health. The model, I know, at least from what I've heard, there's various applications or ideas about applications of this model. And so I'd like to share just more of a historical view, how we have been conceptualizing it as it relates to both infectious and chronic disease prevention. Infectious disease prevention or response is probably the most common way that this is viewed. And then we'll set up where Dr. Lopez will come in and really hone in on how you might be thinking about this from an active living standpoint, in particular with his expertise and past and some recent research that he's done looking at this possibility, as well as a case study to kind of help you put things into play. If you went to CDC and we're looking at definitions, you might see something like this, that it's a complicated, multidisciplinary, collaborative, multisectorial approach. So we're trying to work across local areas, regional, national, and even global. So you'll hear global One Health, for example. We do have that here at Texas A&M. You'll see it related to biosecurity, especially from a global One Health standpoint, with the goal of achieving optimal health outcomes. You can see interconnection between people, animals, plants, and their shared environment. The CDC produces an image, let's say like this, where on the left, you start with all the people that may have an impact on the environment, human and animals, and then the environment itself and how that plays into human and animal health. The idea from their model is about how do all of these three entities, these partners, so to speak, coordinate, communicate, and collaborate in a way that it has a positive impact on the health, not just of the environment, but also of people, animals, plants, and so on. If you dive a little deeper into their website, you might see something like this, where they give some examples of One Health in action. And if it's a bit small, but if you can see that, you can see salmonella, antimicrobial resistance, antibiotic resistance, zoonotic diseases. Again, so most traditionally, this model, and by the way, this One Health approach, even before it was called One Health, as we'll see in just a bit, this approach of looking at both, or all three, animal, human, and environmental health, has been considered for many, many, many years. But being conceptualized under One Health, it allows us to sort of organize our thoughts so that we can think about how do we apply it across various, again, sectors, local, regional, national, global, and so on. And what I'd like to hone in on specifically is how might we apply this in developing education, in developing interventions, in developing programs. And so the definition I like to do, or at least present when we discuss it from that standpoint developmentally, is highlighting the synergy between these three things, these three areas of health, so that we can come up with strategies to start solving some of these problems, which, as we know, are extremely complex in both infectious disease as well as chronic disease, which is my particular area of expertise. What I really like about this model as well, my background, I'm an associate professor in a field called behavioral medicine. And so we look at how behaviors either increase or decrease risk of disease, disability, or premature death, but also the psychology related to that behavior. And so when we start trying to conceptualize a problem, and particularly looking at the risk factors and the determinants, and then how do we come up with education, again, our strategies, interventions, programming, to then improve behavior so that people can adopt the lifestyles that reduce risk of disease, disability, and premature death. Having some organization and having some boundaries, some scope, a systematic approach, some theory, and so on is extremely helpful. And so with this One Health model, there's a few ways to approach it. I'm going to show you the way that we approach it, and there would be differences to this. But the reason that we do it this way is because years ago, I looked at how many different responses had occurred that had utilized this model. And there were some consistencies, largely three steps that I want to share with you now. The first step traditionally was identifying the what. In other words, the disease that's at play here, and then which dimension, either human, animal, or environmental health, is the primary dimension. And you notice I rotate. So in this case, in blue is the human health dimension. That's the disease and where it's impacting. The other two, animal and environmental, are at play. So that's step one. What's the lead dimension, primary dimension? Then we move into the why. This is where you start locating the specific risk factors. Now, by definition, risk factors are those that are increasing risk of that disease within humans, as we see here. But when you have factors that then start impacting or having an effect, you'll see another term come up called determinants. And that's what we see here. We start seeing where, in this example, the animal health dimension has much more play in determining increasing the risk of this disease in humans than does the environmental. But the environmental does have a little bit of overlap as well. And so we like to conceptualize that these aren't perfectly overlapped, so much like a Venn diagram, depending on the disease, depending on the issue, depending on the risk factors, and so on, these might move. Then step three is the how. How in the world do we put this all together? And like these question marks, deriving some sort of strategy, mitigation plan, extension education program that Mike and I work with, research, policy, whatever field. And as you see here, the disease is over to the right. So if you're not familiar with path models, these typically work from left to right. And that's important because if you want to impact the disease in this case, then you need to impact the risk factors. But if you want to impact the risk factors, then you need to impact, and again, in this One Health model, the determinants, both of animal health and environmental health. And if you want to affect those determinants, you got to develop some strategies then to do that: education, policy, research, and so on. And so by working left to right, now we can start reducing those risks. And back when we talked about the first definition or two, it talked about how complex this was, and you'll start to see that as we go through. Probably one of the most classic examples, excuse me, of using this model, again, before the model really existed, right, was the cholera epidemic in London in the 19th century. If you're not familiar with this, cholera bacteria was having damaging effects. And of course, it was affecting humans right off the bat. So in our model, the what, we would put cholera, the bacteria, and human dimension as the primary dimension. If we look at how things were handled, again, it's very complex, and I highly recommend reading up on this. But step two would be the why. And so as you see, as far as risk factors go, there was, over time, they learned that eventually that it was not necessarily in the air, miasma, it was ingestion through the water, which was also associated with poor sanitation around that water. Then if we had to create some overlap of these determinants, the environment, as you see in green, those determinants were a little bit stronger. Cesspools, the sewage systems that were down in many basements below the floor, the water pump, if you remember Dr. John Snow, being able to go in and actually removing that water pump and in essence ending this issue. But also there was cow sheds, slaughterhouses, and feces that would run down the streets that would also be infecting the water as well, infecting people and the environment. So you see where all those start to overlap. If we move to step three, again, hindsight being 2020, this might be a model of how this was eventually fixed and mitigated as much as it could from happening in the future or continuing. There was a mix, as you see, of education related to miasma theory, that you're breathing this bacteria in. There was a cholera bill, the Public Health Act of 1875. There was new changes to the environment as it would relate to the sewage system. Instead of just dumping it out in the water, what are better ways that we can process that sewage? John Snow's research, of course, and removing that water pump, making an immediate positive impact. How do we reconsider the cow sheds, the slaughterhouses, and how is that processed? More education on that, more education on the ingestion of water and poor sanitation, how to boil water, and so on. And what effects does that have? Does it help? Does it not help? As it would relate to cholera. And so again, hindsight being 2020, we can look and see how this interaction within the One Health model of human health, animal health, and environmental health were both interacting in a very prominent way. But then what was the response, the intervention, the policy, and the education? And so again, our field of chronic disease prevention, which will get us into physical activity, as one of our main benefits that we focus on out of the Family and Community Health Unit. We often look at the leading causes of death. So this is 2020, the leading top 10 causes of death in the US. And you see heart disease is number one, cancer is number two. About 50% of all deaths result of premature death from heart disease and cancer. So if we were to utilize just as a thought process, a test of putting heart disease as the primary dimension being human health, and heart disease being our disease of interest. Well, we might list some determinants: high cholesterol, high blood glucose, central obesity, so that's obesity in the gut, visceral fat, as you might hear it called, unhealthy diet, low physical activity. These are not only physical risk factors, but lifestyle risk factors. Then we have some overlap, right? And again, I think we could probably have a discussion on what this is. But as an example, if we look at environmental access, environmental health factors, low plant food intake, high processed food and oil. What about access to these foods, produce, fresh produce, as we're dealing in rural areas right now? Access to physical activity. How does the media play into this and that social environment? And then if we look on the animal side, well, maybe we focus on a couple of things, meat quality, meat processing, and so on. And how does that link in to heart disease, either increasing the risk or reducing the risk of heart disease? So again, we could play with this, but the whole point, once you start aligning these, is to then move to step three. And then how do we start arranging where heart disease is over to the right, We have the risk factors in blue with human health. And then how does the environment and the animal health impact that? But to reiterate, that can't be the end, at least from our perspective with extension education, research and policy is, okay, what is the education that we need to do? What areas, how do we affect some of these in a positive way so that we can create the change so that it works downstream, again, from left to right to reduce the risk of heart disease. And so much of the area that I focus on, for example, is down at the bottom with education as it would relate to lifestyle as medicine. How does lifestyle, including physical activity, reduce the risk of chronic disease or heart disease in this example? What do we need to do at the med schools to start teaching this a bit earlier? And this is some of the work I do at Texas A&M School of Medicine. What about public health initiative? What about in extension, the larger scale activities that we can do? What programs do we have? And are we approaching educating on the environmental side? If so, who? Is it individuals? Is it groups? Is it early childhood? Where do we focus our attention? And can we do all of it? Or do we need to select, say, this is the piece that I can contribute to? And then partner with others who can contribute to other things and other aspects of the prevention of heart disease. The complexity of this, the model is helpful, again, because it does help create some borders, right? So I can start thinking about a problem and conceptualizing it in a way. But even when we do that, as you see with this just quick example, and there could be way more boxes here, but it does allow us to start thinking about how we might hone in on an area that we can impact. And hopefully, in this sort of arrangement of the One Health model, you'll be able to start thinking about that too. Where do I fit in as it relates to reducing risks from the determinants and eventually or directly the risk factors that lead to whatever disease? Now, we are looking at infectious disease and chronic disease, not only in prevention, but also as a response. When we start thinking about environment, we'll have to start thinking about, at least from our perspective, that the environment is one piece of this, but the behavior, the utilization of that environment. So if you increase green space, for example, there still is the behavioral and the psychological aspects of people wanting to, being motivated to, overcoming barriers to actually get to that space and then participate in physical activity. And so much like the One Health model that has these three components of animal, human, and environmental, the problem with it is, if it had a negative, so to speak, is that it doesn't specifically give us information about the behavior. Again, that's where we have to be creative and come up with those solutions. But before I leave and pass it over to Dr. Lopez to give you some tangible examples of how this is being done with his expertise in active living, is I wanted to introduce you to, if you don't know about this theory called the social cognitive theory. It is compatible in a way with this One Health model and helps us understand some interactions between behavior and the environment and then personal factors. This is Dr. Albert Bandura here, and a couple quotes from him is that behavior in his theory is not simply the result of the environment and the person, just like the environment is not simply the result of the person and the behavior. Instead, he presents the idea that these three components are constantly influencing each other, meaning a change in one component is going to have implications on the other components. So if you have a change in behavior, you're going to have a change potentially in the environment, in the person, and so on. This is generally represented something like this, and it's called reciprocal determinism. So we saw earlier the idea of a determinant, meaning there's a variable or a factor that's impacting something else. And so when we label that as a determinant, you'll see in models an arrow pop up indicating that this variable is impacting this variable because there's an arrow pointing to it. It's called a direct effect. Now, in this example, you see with social cognitive theory, it's bidirectional, and that's where we get the reciprocal determinism. And that's the quote that we just saw from Dr. Bandura. If you change the environment, the idea is, could that impact behavior? Same thing, if you change behavior, how does that impact the environment? And again, in this theory, these do not exist in isolation. If you change one, you're going to start influencing the other. The environment, not only the physical surroundings, but the social context, the social norms, the social support, the social influences, as well as situational context that sort of change depending on what time I'm at, geography, and so on. On the personal side, this is all about the individual factors that they had. I mentioned earlier about motivation or confidence in their abilities, outcome expectations, their cognitive ability, whatever physical characteristics or limitations they might have, beliefs, their values, and then their pure preferences, what they like, what they don't like, attitude. We talk a lot in our work about, if we're talking about physical activity, do people even like physical activity? If so, what type of physical activity? Just because I like it doesn't mean that another person will. And actually find that those early in the adoption stages of physical activity, enjoyment is not one of their main motivators. And so we can tell them, oh, you're going to love it, you're going to love it, you're going to love it. And maybe they will, but that's a hesitancy, a barrier for many new exercisers. And so understanding those personal factors become very important when we start coming up with interventions to help promote and then to help people try out some of these environmental access points that they have, and then start see if they do like it or not. And then once they have that experience, how do we respond to them? And Dr. Lopez will talk some about that in just a minute. I did want to highlight, to transition over to him, is that efficacy beliefs in this theory, this is the belief, the confidence in my own abilities to do something, are very powerful in affecting this model. In other words, the One Health model, but specifically the social cognitive theory, is conditional, right? Just because this exists doesn't mean these arrows are always going to work, in other words. Not with every individual, not with every population, not with every geography. So whatever your area of interest is, just know that once you identify some of these conditional factors, maybe it is their beliefs in themselves, maybe it is their attitude, or over on the right, between behavior and environment, which we're talking about today, outcome expectations. Do I think it's going to work? Do I think it's going to be benefit? If it's an external space, do I believe it's going to be safe or not? And so our beliefs and attitudes about the environment, not only the behavior, can play in to the decisions. And so a question that we ask, and Mike helps us answer, thankfully, is if we build something, will people come? If we create changes in the environment based on one of these models, the One Health model in particular, will people begin to utilize that? If I change the physical environment, will that have an impact on the human health and the human environment internally? And so with that, I'm going to pose that question, but leave it that way Dr. Lopez can help us answer that question. And I'll stay around for any questions that you might have for me at the end.
Perfect. Thank you. I'm just pulling together my screens real quick. Let me see here. All right, we're going to do that. I'll try to see the participants too. And then get my video on. Okay. I think I am all geared up now with with everything. And I think I can see the chat. I think I can see the participants, and I think I could see video as well. And I'm seeing some acknowledgement from Dr. Ferris that he could hear me. So I'm assuming that that's working as well. So thank you for that introduction, and I really appreciate the organizing group with allowing us to come here and share a little bit more of an introduction to One Health, and in particular my section where we're talking a little bit more about applying that some of the foundational pieces that Dr. Ferris talked about as it relates to active living, which is a lot of the work that I do day to day. I've been a little bit for background, for context, I've been with the Extension for nearly 12 years now, where I'm an Extension program specialist, primarily focused on active living. And so I do have some programmatic experiences that, or programmatic efforts that I help support across the state, but then also from a subject matter area, I am very interested in active living, and in particular, the environmental influences on our behavior decisions. That background, or that interest, came from a background, my master's work is in urban planning, and where I was very focused on park master planning, city comprehensive planning, action planning for built environment changes to encourage walking, bicycling, and movability or moving. And I had this, moments of self-reflection through, some of my early projects are, which is exactly what Dr. Ferris was talking about, that we have these environments that we're building. We as practitioners or researchers may feel that they are supportive environments for physical activity, but how does behavior influence that decision to use that particular place, and how does that perspective of a supportive environment change from person to person, and how might we be able to pivot perhaps our education or other resources to help engage participants on that, or people on that journey towards a more active lifestyle. And that's when I decided to go back, do my doctoral work in public health, and really get a nice background, a theoretical background, much that Dr. Ferris mentioned with social cognitive theory, et cetera, that I'll talk through a little bit of some dissertation work, a little bit of what we're doing within extension, and then share a case study example of how we're applying the One Health approach, or an example of the One Health approach as it relates to an active living project. And so with that as an introduction, I would also like to build on that introduction with a little bit of background of active living. One is a definition, to give us some guidance as it relates to active living, but then also how that guides us within AgriLife Extension, some of our education and resources that we offer. And so as we're thinking of active living, Dr. Ferris mentioned a couple of times physical activity, access to physical activity. Active living is a broader concept that does incorporate recreational activities, physical activity, and exercise. Not all physical activity is exercise, but all exercise is physical activity. And that was very in the forefront in the 90s, especially as we had our first connection in the public health field with physical activity and health, and an emphasis on that connection and recreational activities, but also happening at that same time. And as we were making those, first connections, we were also finding out that there were other disciplines that were doing work related to physical activity that may not necessarily fit within the domain of recreational activities. And for example, just coming from a planning background, so urban planners, transportation planners, urban designers were, interested in how the use of land may influence our behavior as it relates to walking, or talking about multimodal transportation. So what are those different modes of transportation besides vehicle transportation, like walking, biking, moving, etc. And so this kind of led to a development of a model, and it's an ecological model because it does include a variety of different levels that help us understand behavior, in this case, physical activity and active living. And part of that model was introducing these other domains that influence this broader concept. And so that was household and occupational activities, as well as the role of active transportation. And so that's kind of the broad idea, broad concept of active living. And then some of our efforts within AgriLife Extension is that we do focus, especially in the active living space, on evidence-based program and resources that help Texans across the lifespan learn to adopt and hopefully maintain a healthy, active lifestyle. And I'll talk a little bit about some program efforts that are related to that, as well as some project efforts that are related to that as our case study example. But I do want to build a little bit on the foundational piece too, because and also I want a little interaction as well. So I appreciate Robin getting us jump started in the chat as well, with the hopeful enjoyment of the presentations, but also feedback, also questions. Feel free to drop them in the chat. We'll have some time afterwards to help answer some of those questions. And then also a response, Houston kind of moving towards, no pun intended, becoming a walkable city, especially perhaps after a unique planning perspective to the organization of the city. But So to kind of talk through and just, I do want to highlight, we're going to do a little bit of an experiment as well with this, but we are going to look at the connections between environmental health, human health, and animal health, and how they all contribute to One Health. And each of these components can be branches, if you will, off of this, centralized One Health that's located here. And so what I'm going to try to do in the next, 10, 15 minutes or so is we're going to talk through how you and perhaps some of your active living work may contribute to One Health. And so we'll start by reminding ourselves what these colors mean and what they represent. And the colors are designated in the text box as well. But I will go through that. So starting on the right side, we have this blue box here that represents animals. And we can see, animals exist everywhere. Numerous animals come in contact with people in our lives. Some examples just off the top of my head include cattle, goats, birds, cats, dogs, reptiles, other wildlife, aquatic species, etc. And so that kind of fits in our bucket here of this, animal bucket or box. We also have this red box that represents the environment. And so people and animals come into contact with the environment by using places in our community. So if we're thinking about this in an active living context, us engaging in places in our community, we're engaging in environments. We're engaging in environments and coming into contact with our environments. And part of my work is understanding how that environment influences our behavior. But other examples that just include or comprise of the environment include air, water, like rivers, lakes, or ponds, and ground, like soil, pasture, or forest. And then our central box here is the human box. It's the yellow there represents humans. And humans are anyone that come in contact with animals, the environment, or another person who has contact with each other. So people come in contact with animals through pets, agriculture, or zoos, or through nature, etc. And so let's go ahead and do an experiment to look at some of the interactions, and let's separate some of these interactions out to help us with this approach. And so on this slide now, you should be able to see two bottles that are filled about a third of the way with a red liquid, which is here on the left side, which is our representation of the environments, and a yellow liquid, which is our representation of humans. And so we are pouring both of those bottles into this larger cup, and we now have a new color, which is orange. Orange for us is going to represent our human and environmental interactions. And so just some examples of this might be humans polluting the air with chemicals such as carbon monoxide by driving cars, or contaminating the ground and water with pollutants found in industrial chemicals, for example. But what I want to ask y'all is, in the chat box, would you be willing to describe how you interact with your environment as it relates to active living? So take a few seconds, let's take like 30 seconds or a minute. And if you can, type in the text box for me how you interact with your environment as it relates to active living. And I'll pause for about 15 seconds for us to collect some thoughts. And if we need some further guidance on that too, I might interject just to help us formulate our thoughts. But as it relates to active living, so, in your household, occupation, community, and engaging with some sort of setting or place, how do you interact with your environment as it relates to active living? Is it walking or moving in a park? We have one example in the text box: trail walking, exploration of nature with the kiddos. So two examples there of how Dr. Ferris interacts with the environment. So we have a new gardener as well. And so here, both at home and perhaps a community garden too. So that's the interaction with the environment there. And so we have walking, bird watching, and camping. Okay, another great example there. And then a final one that's listed in there: hiking, urban walks. So a great example of of navigating through an urban space, plant identification, and then I work on a nature preserve as well. So also interacting with that environment, walking in the park, weekly volunteer work, as well as daily dog walks. So Isabel, remember that when we're gonna talk about the next interaction. And then walking in the outdoors, right? So a great example there from Alice. Thank y'all for sharing that. If you want to continue to type thoughts, please continue to do so. But let's go ahead, and those are great examples of how we were interacting with our environments as humans. And so let's look at another experiment quick. And what we're going to do now is we have two bottles again. We're going to combine blue with yellow to make green. And so we could see blue, again, just to remind us, represents animals, and then yellow represents humans. And so green in this example, now that we've poured those two liquids together and have this interaction, green represents animal and human interactions. So 6 out of 10 new human diseases are considered to be of animal origin. So these diseases could be passed between humans and animals. As Dr. Ferris mentioned, zoonotic diseases is the common terminology that we might be familiar with in this example. So in the chat box now, I want you to describe how you interact with animals as it relates to active living. So again, if you don't mind taking a little bit of time and just typing out in the chat box how, again, our combination here is going to be healthy animals and humans. How do we interact with animals as it relates to active living? So I'm going to pick on Isabel that did a great example of daily dog walks. And so that is one way that Isabel is interacting with an animal. And then Nancy dropped in the chat, walking dog, bird feeding and watching, chasing squirrels away from my fruit trees, running away from dogs in my neighborhood. Okay, so 2 examples there of running away from animals in that interaction. Enjoying wildlife when I'm lucky enough to see them, bird feeding, watching, swimming with my dog in the Gulf, and seeing deer when walking in the neighborhood, dog walks, horse care, stall cleaning, manure composting. That might be a good example for our next one as well, wildlife watching, and our last one of engaging with the environment too. Feeding birds and squirrels in the park, etc. Okay, so thank you all for a couple of great examples there. A lot of what you had shared are what I like us to remind ourselves on or reflect about is we see some positive interactions. You know, we see wanting to watch birds. We want to interact with squirrels. Actually, there was one on a positive, feeding the squirrels, but then maybe one on a different approach and more squirrels were impacting the particular ideal environment, i.e. fruit trees in one example. And then something that came up in a lot of my doctoral research when we were talking about some of the influences for why we use or don't use spaces, pests and insects and other wildlife species typically came up in as something that influences the use negatively. So it is a deterrent of people utilizing a particular space. Dogs, whether that be stray dogs, whether that be loose dogs, whether that be whatever that includes, was also something that came up quite a bit in my doctoral research. But so great examples there. Okay, so we could go also to the next thing. We're doing a great job applying some of the concepts, and we're going to go to once again, let's combine the final 2 colors here. Okay, so what we're going to do is we're going to combine the blue, so the animals, with the red, the environment. And that gives us this kind of purplish kind of looking, it might be more lilac in our example on the screen, but a purplish representation of animal and environment interactions. And so animals interact with their environment the same way that humans do. So I also want us to remember that animals are also living and eating and breathing in our environments or in the environments. Deer, we saw deer, for example, in the text chat. Deer live in a forest or other environments, and they eat the grass and they drink the water, etc. And we looked at, and we might have already seen a couple of examples. I'll look at manure composting, for example, of perhaps an interaction of animals with the environment or an animal byproduct with the environment. And so We won't ask this particular question, but I do. I think I want to have one more question that we'll ask once we wrap up this experiment and we combine everything. Okay. So for our last experiment, what we're going to do is we're going to mix each of these colors and come up with, you might have already guessed it because it already showed here, a grayish looking color. So this grayish looking color represents that animal, environmental, and human connections that we've been talking about. We all must be aware of the impact that our actions have. Everything we do not only affects ourselves and thinking, just our human selves, but also everything around us, as the social cognitive theory describes, as ecological models describe, as the One Health approach describes. So if we could reflect on, think about when you go for a long nature walk, for example, or a nature walk, for example. Oftentimes we may bring, a water bottle or snacks with us on this particular walk, especially if it's something that might be a little bit longer. And so on trails, we see garbage containers that are usually available and are intended to help reduce the human impact on the environment. And if we do a good job of throwing trash instead of littering, animals and the environment may not be affected, perhaps, of some of our efforts or some of our interaction with that particular environment as humans. And so a final question, which I think some of us might have covered in the chat, we might need to restate it maybe a little bit, but is when you are being active, particularly outside the home, and what I mean by this is just outside, like not inside the home. We might have, spaces outside of our dwelling unit or our actual home where, like a garden, for example, or something like that. But so when you are being active, you are interacting with animals and the environment. Do you have any other examples or does anyone have any other examples that they'd like to share of this kind of interaction with the environment, with animals, and with you as a human? And if you'd be willing to type up that as well and maybe throw a final one in the chat, we could look at a pretty great approach or look at some other examples of, all of this interaction coming together. And I will pick on, I think, one of them that, and I might be just coming up with an assumption in this case, but interacting with our garden outside our house, and maybe pests or other animals or other influences that are out there that might be a part of that interaction too. So that might be one example of all of those interacting together. Okay. And so if you are typing, go ahead and continue to type. But what I'm going to do is I'm going to go ahead and bring up our next one. And I want to reintroduce this image because it's going to help when we apply it to the case study example that I'm going to share, of just an extension example of how you might be able to frame an effort or a project within maybe a One Health approach, or come to that project with a One Health approach in mind. And so I do just want to re-describe or reintroduce this image where it does talk about us bringing together people who have these backgrounds and have these influences on some of these environments that might include or might be included within One Health. And so typically within public health or perhaps extension, outreach, and work, we might be heavy focused on connecting with partners and organizations that have similar goals and outcomes to us, right? We might be partnering with those that have those health outcomes in mind. But what are maybe some of those other partnerships that we might be able to bring in that perhaps, have other interests as well as other goals that might still align with our outcomes? And so that's on the far left here. And then what I want y'all, as we're going through this case study, I want you to see how this example, how some of the partnerships were coordinated, how each of them were collaborated to meet each representative's goals as a group, as well as how communication was, not only with potential participants and people that they wanted to engage with this project, but also perhaps some communication within partners and organizations as well, to hopefully achieve the best outcomes that we can as it relates to people, animals, plants, and our environment. And so to look at this case study, I'm going to bring us to East and Northeast Texas, and look at a project that was conducted by a variety of different partners, which I'll share toward the end. But in particular, two of our county extension agents in the family and community health discipline focused on an interactive trail. And we'll talk about what some of the project components comprised of. But I am bringing us to, if you're not in Texas, or if you're perhaps not from this Northeast area, just to give you a little mindset of where we're at. This is on the top part. Actually, both of the agents are from Lamar County here on the left, and Red River here, which is a border county with the state of Oklahoma. And there is a long, over 100-mile trail that goes through, starts in East Collin County. It's a little northeast of Plano, if you're familiar with that area, and goes all the way east. And so that's a little background. And there's a multiple trail pathways that are included here. Some crushed granite. There's a bridge that repurposed, and all of that just as foundation or for background. So some of the components of the project was developing out what they titled an interactive trail. And so as part of this interactive trail, there were 12 signs with QR codes, as well as trailhead introduction signs that had legends on, what the interactive trail signs look like, and all of that. Each of the trail signs had unique information. And this is where some of that One Health approach comes in, right? We might automatically think of, when we think of maybe trying to increase physical activity or help support a more active lifestyle, we might automatically think of including, physical activity components into maybe some education that we're doing. And for example, that might be an outdoor gym, stations, fitness stations might be our example of this, or signage that has, representation of physical activities. So that was included, but then they also included some nature components to help share and help have an understanding of us as humans interacting with the environment that we're interacting with on that particular trail. And so some of it had nature components, and then some of it had a little historical components about the trail too. That was a project that had some behavior or environmental change that went along with it. So these signs were actually movable. They had them installed at certain locations, but then they also moved them around and had some unique incentives for tracking and evaluating where those fitness stations or where those interactive trail signs were. So that was one piece of it, and that was kind of a more environmental change approach. And then now looking at a programmatic approach. And so with kind of what Dr. Ferris was mentioned of, you may be creating these supportive environments, but how are you perhaps motivating behavior change? And one strategy that Extension has taken on is we have a variety of physical activity promotion programs that have or follow the theoretical frameworks as it relates to behavior change. So for example, social cognitive theory is one of our theoretical frameworks that's embedded into some of our online team-based physical activity programs that I support. And that website is listed here on the slide. You could see it in the bottom right here, just in case you ever want to, or if you're looking for a physical activity promotion program that might be able to help enhance some of your other education or resource opportunities that you share with your clients or participants. And then this is just an example of communicating and sharing some of that information. They organized a physical activity promotion program in conjunction with the environmental changes that they were doing as well. And so that's a program piece. And then from a promotion piece, they included promotional information that relates to physical activity and adopting a more active lifestyle, but it also related to some environmental, sharing some environmental information and education. And so part of that was related to just the environment, and they were able to do that through Earth Day, as well as some of their educational demonstrations and resources that they had that related to nature and the trail environment. And then also had some animal health and some animal education, where they had some bird. So for some of the bird watchers or bird listeners, they had some examples of some bird sounds that you might hear while on the trail. So something that if you work in maybe a nature preserve or something, you might be very familiar with. But it was a great piece that they added into some of their promotional efforts. And then as far as partners, and so looking at this collaborative approach, so bringing all of these partners together to support this project that may or may not be some of our traditional partners that we work in within AgriLife Extension. Some of those partners, a large coalition that focuses or explores the Northeast Texas trails and supports some of the work that's done there. A couple of city partnerships that, for one example, had a partnership with the police department that was located right off the trail. So there was some education on safety, being safe on the trails from a human element, but also from an animal element as well. A partnership with the Red River Texas Master Naturalists, as well as another local county extension agent that focuses particularly on agriculture and natural resources. And then our two family and community health extension agents that typically focus on programmatic efforts related to health with the goal of improving health outcomes and reducing health disparities. But as you can see from this case study example, it also included some other elements to it that built on some of the behavior change work that they were focused, that they may be tasked with within their professional discipline. So as you're thinking about maybe some objectives to apply this approach to active living, I just want to kind of maybe share a couple of the approaches or the objectives that we aim for with some of our programmatic efforts. Is first and foremost, given that my primary focus is active living, at the end of the day, one of my main objectives and some of our objectives, one of our key objective under the active living banner may be to motivate participants to adopt physical activity behavior. But also at the same time, we could do some of these other objectives like improving awareness and knowledge of One Health and how that approach could support active living efforts. We could help people better understand the connections between environmental, human, and animal health, like many of us who are most likely practitioners, the ones listening today. We could help people better understand those connections and how they all work together while we are using these spaces within our communities. We could also develop unique relationships and networks among partners to facilitate more effective and efficient education and response efforts. That could be, infectious disease related, and something that we may be very familiar with in the One Health approach, but it could also be related to active living, as we've seen. And then also conducting research to better understand the health and interrelatedness of all different species. And so with that, as I'm looking at time, I want to make sure we leave a little bit of time for questions. Feel free to stay connected. I just really thank the two county extension agents that let me share a little bit of the work that they did as a case study for applying the One Health approach to active living efforts. And so if you'd like to contact them, if you're from that area, I highly encourage you reaching out to them. But also if you'd like to stay connected to some of the work that we're doing here, please feel free to give me a shout or send an email. So thank you for your time and attention, and I think we'll open it up for questions.
All right. Thank y'all so much. This was really I loved it. The presentations were wonderful. And my background is in public health, so this was really interesting for me. So thank you, Dr. Mike and Dr. Mark. So we are just about at 3 o'clock, and we didn't want to take up too much of your time, but we did want to invite you all to listen to our great presenters. Before we head out, I do want to invite you all to complete our evaluation. I will put the link right here in the chat. And we would really appreciate if you could take a few moments to do the evaluation. And while we do that, if there are any questions or any feedback that you would like to share with our presenters today, please feel free, and you could unmic and you can, ask our presenters any questions, or if you have any feedback. I'm sure that I won't speak for them, but I'm sure they would love to hear from you as well. So let me mute myself. All right, so we do have a question. Did you run into much resistance with any of your initiatives?
I don't mind sharing I'm guessing that's probably about the case study, and also from a couple of the other projects that we've done when we're, building in, no pun intended, some of these environmental changes, especially when we're leaning on our partners or other organizations that might be the ones spearheading or making some of the environmental changes. Is I wouldn't say more resistance, more getting the time it takes for some of these efforts to go into place and to ensure that we're following all of the policies and procedures and interacting with the partners that may or may not have a stake in the project. And environmental change does take a long time, especially if you're working towards long-term infrastructure changes, where there may be that's something that takes a little bit longer. But I think one of the ways that we've been able to address that and to keep the motivation is to also doing some shorter term demonstrations as well as other education efforts to help not only continue to share some of the benefits that not only are related to health, but also why some of those partners may be interested and why some of these efforts benefit them in their contexts. But also to, to help continue to keep people enthusiastic and excited and still feel that, things are happening. And there are some shorter term demonstrations and other projects that are typically involved that help continue that motivation. But that's a good question.
Yeah, great question. Thank you. We have another question that's in the chat. So what's the best way for teachers, environmental educators, and other community people? How are they able to better utilize One Health?
And I don't mind jumping in real quick just to say, I'm going to drop in a link, a activity guide. It's a 4-H curriculum. I forgot to mention that the activity kind of running through it, applying it to active living, was actually developed out of Michigan State University Extension. And so I'll drop that link and maybe we could share it as an example, as a follow-up. But sorry, go ahead, Dr. Ferris.
Yeah, that's great, Mike. So to follow up actually to both of those questions, a lot of the resistance we get with behavior recently, for sure since the pandemic, has been resistance to feelings of being coerced or being forced into having to act in a particular way. And those who may be encouraging or implementing some of these strategies, they may not purposely trying to make people feel coerced or forced into things. But again, it's all about the perceptions of those people. Theoretically, the undermining of personal autonomy, which is considered in kind of an innate human need, is problematic from a behavior change and has been producing, from what we finding, resistance. And so the big solution as it relates to One Health and environmental changes, and goes into the great question that Alice had about teachers, at least my thinking is, you first want to provide options for people that they have the ability to be self-determined, that they can make decisions for themselves and have choices and opportunities. That's easier said than done in certain cases, but choice and options are extremely important. Providing rationale and acknowledging feelings are also two big factors as it relates to supporting autonomy in decision-making. So Alice, the question about teachers, we're finding that if you get people to experience those things and have an initial positive experience, and so years ago there was a study, for example, done that would bring inactive adults into a lab, and they would do 30 minutes of a physical activity, like on a treadmill or a bike. And again, what their findings would be applied to outdoor walking, physical activity as well. But what they did was they measured halfway through at minute 15 how they felt, and it's with one scale that ranges from -5, very bad, to 0, neutral, to +5, very good. It's called the feeling scale. And all they did at minute 15, they circled where they felt at that moment. That feeling was predictive of how active they were 1 year later. And so I asked my students if they've ever been on a bad first date. And unfortunately, too many raised their hand. I was like, it's hard to go on a second date. And so that first experience with outdoors, with nature, is really important to get that first experience and have the ability to discuss that and to be open about their concerns and their barriers and that resistance. And then to be able to work with them to come up with options that are suitable to them, that are aligned with their beliefs and their values and some of the interests that they have, so that they can move their way into it. And that is a challenge when it comes to policies and systems, environmental changes that can be perceived as sort of undermining that for people, and finding that balance between that level and the individual needs and values is tough. But I think that experience and that discussion can be one way to bridge that gap.
Wow, that's a really neat experience. I mean, I would be interested in doing some research or following up on it, just to kind of see who all had that neutral, who all had the negative, and who all had that positive. I might try that for myself, actually. So I'll see if there are any more questions in the chat. No, so I don't see any other questions in the chat, but the questions that were asked, they were wonderful, and we appreciate y'all taking some extra time to answer those for us. If there is nothing else, we thank you again. We thank y'all so much. This is a wonderful presentation, a wonderful webinar, especially the day after the Love Day, especially after Valentine's Day. So we thank y'all again, and thank you everyone for tuning in with us. We do have another webinar that's coming up March 1st, and it is Researching Resilience. So if you are free and available that day, we encourage you and invite you to check out that webinar. The link is in the chat to Researching Resilience, and it's 3:03. We'll go ahead and let you all enjoy the rest of your Wednesday. Please look for that email from Alice, and you do have Dr. Mike and Dr. Mark's contact information if you want to touch base with them further. So yeah, I thank you all again, and enjoy the rest of your afternoon, and thank you all. Bye-bye.